Hello and welcome to Crushing Doubts Q&A every Monday at 6 p.m. Eastern, 3 p.m. Pacific. It's great to be here with you again. We're going to be here every Monday except for Labor Day coming up. I don't anticipate any other days except maybe Indigenous Peoples or Columbus Day, depending on which you celebrate. Guys, it is great to be here with you. And as always, I'm just kind of looking forward to continuing to talk through these questions. As you guys know, my system is all about getting your questions answered to your full satisfaction. And that's partly because when I was suffering with my 8 years of back pain and even beyond, the main thing that got me through was understanding everything I needed to know. So I've developed a system to do that. Of course, you guys, those of you who know this, know it's the column system. There's the emotions column, the doubt column, and the power column. And we're going to go through different questions and locate, well, how does this relate to these columns? And what do we do with these columns? What do we do with that information? And I look forward to discussing that with you. As always, we do have these ongoing seminars going that give you the information that you're going to need to understand the mind-body experience in general. One of the things I say at the beginning of the seminars is that you have way too many questions that are not getting answered. And you also have questions that are getting answered in ways that are not making a lot of sense. The whole idea is to take all of that information and consolidate it into one system that you can believe in and feel that answers all of those questions. So the seminars are designed to do that. The next one is coming up. It begins on September 19th. We have another one in November. They're at different times because I like to offer different time slots because this is an international community at this point. We have got people across the globe using the columns to get better. So check out the seminars. You can go to www.crushingdoubt.org. After the seminars, or even before them, if you want to do it this way, you can join my membership groups, which allow you to do similar to what we're doing in this Q&A, but with a lot more back and forth. It's it's a Zoom call, the group memberships, where we can go through moment-to-moment experience and talk about what you guys are experiencing, how to think about it from a columns perspective, and what to do about it. So, without further ado, let's get to some questions. I want to welcome some people who have joined us. On Instagram, we've got Lucy Oden. We've got Michelle. Good to see you. Catherine Toomer has joined us. Justine, I'm just going to say your name because I always fumble your Instagram handle. Sue Conte is with us. Daniel Starkey's with us. Good to see you all. And we've got Jane Smith has joined us on YouTube. She says, "Hi, Dr. Dan. Thanks for being here again and answering our questions. It is my pleasure, Jane. Glad to be here with you." Dorisa is saying hi to me and everybody. Good to see you, Dorisa. So Jane has a question coming in. We'll start with this. As always, if you do have questions that you want to get in advance, let's say you're not going to be able to attend, you can send me an email at dan@crushingdoubt.org with a preloaded question. But Jane's got one right live here, and we're going to get right to it. Jane Smith says, "I am again asking about the emotions column. When I had a sudden pain uptick, I was able to make the pain worse by thinking about a particular theme. Does that indicate I was on the right track?" Okay, you guys asked such great questions. I want to highlight why this is a particularly useful question for a lot of people. The main thing that we want to establish when it comes to the columns is the link between thinking and feeling and symptoms. So even if it comes with an uptick, we're still making a huge gain because the clarity of seeing that our changed thinking led to changed symptoms actually establishes the same thing. Now, obviously, ultimately, we want it to happen in ways where the pain or symptom gets better, but you're still on the right track, absolutely. And Jane, I if you're willing to, I'd love to get some follow-up to this, to hear what was it that you were thinking that led to the symptoms going up. Part of the reason that I ask is that if we highlight these things, it not only helps you, but it helps all of the viewers and listeners who can grasp why it is that we can really see that thinking and feeling really does change your symptoms. So any big change in symptoms tends to indicate that you're on the right track when you're actively doing the work. When you have a sudden change in symptoms out of nowhere that didn't relate to doing the work, that indicates something's going on that you need to be aware of and attend to, especially in the emotions column where Jane's talking about this. When symptoms go up or down in some dramatic way, it's telling us we're in the right ballpark. And there's more that can be said about when a symptom gets worse when you hit on the emotional theme, because sometimes that's leading towards power column work where you're getting in touch with that fullness of your trauma. because the emotions column is where you experience your symptoms as they relate to emotional expression of that moment. The power column is where you experience emotional symptoms that aren't of the moment. They're about your overall experience in life. That's a little confusing because emotional themes are also, as we gather them, they're guided by what goes on in our lives, but they're always about what's happening in the moment. The power column is more about processing your overall experience. If you guys have questions about that, please do let me know, because it is an important distinction and one that's not so easy to understand at first. And I'll keep saying it again and again in ways that can help. Terry Centrone, good to see you. And Terry, another Terry, Chuck Brown Productions is here as well. Back-to-back Terrys. Good to see you both. All right, it looks like we have time for a preloaded question at the moment. So we're going to get one in because questions do tend to roll in. Actually, this may be from you, Jane. I don't know. It is from AJ. So here it is. I got a headache this afternoon, and I noticed it started the moment one of my core themes in the emotional column was triggered by a friend's text. This is almost certainly you, Jane Smith. But knowing that didn't help the pain. The headache turned into a migraine by the evening. I'm not sure what I could have done better. Okay, so actually, I think we covered this last time. This may have been a mistaken preloaded question that was actually already done. So what I said, though, for people who are just tuning in, because it could still be useful to them, and Jane, it could still be useful to you to go over it as well, is that sometimes you're not getting specific enough. My rule of thumb is this. If you are in the right ballpark, you've got the right idea of the theme, but not the specifics, the symptoms should reduce proportionally. So let's say you've got the general idea and it reduces halfway. Well, you essentially have half the right idea. The symptoms are always communicating what's going on with these symptoms. The symptoms are always communicating what's going on with your feelings, especially in the emotions column. So that's one key. In the column system, always back up and remember what are the functions of these columns. I try to keep it very simple for multiple reasons. One of them is that it actually is this simple. But that simplicity is incredibly organizing and can allow you to step back and know what you need at a given moment. So just as a review, in the emotions column, it is about the onset and uptick in symptoms, and that is telling you that there is some kind of distraction experience where the symptom is designed to get you away from the emotional experience. Once you make that emotion conscious, that symptom goes down. It goes down proportionally if you've got the right idea, general idea, but you don't have the specifics. That's when it goes down proportionally. When you nail it specifically, it should vanish if it's an emotions column symptom. If there's doubt on top of it, that's another reason that symptom could kind of stay stuck there. If it's a power column symptom, that's another way. And let's go through the functions of that. The doubt column is, from a psychological defense strategy standpoint, is designed to keep the whole system in place. It's just designed to keep you off balance all the time. So it raises doubts over and over and over in whatever way it can. In the power column, the symptoms are designed to get you a communication. They're designed to get you in touch with the overall structure of your emotional life and to get to the fullness of your trauma. And there it's a communication. And in the groups today, I said something that could be really useful to share with you guys. That is that when you receive the communication, it doesn't just vanish. The communication is something you need to sit with. So a power column symptom is usually one that when you discover it, you're going to need to take some time with, because that's by design. It's trying to communicate something big to you, and it usually takes some time to understand what the communication really means. And that's why it can linger. So multiple reasons symptoms can linger, but at least I've got them down to just a couple that you can understand in the columns, and I can help you elucidate which one is which when. Sylvia Sierra, good to see you again. It's been a while. And Rita, good to see you as well. Okay, Jane Smith has a follow-up, and she says, none of the themes on the list I've created have ever helped, but today I thought about my stress regarding running out of time. Someone close died. Then my pain got worse and then shifted somewhere else. Okay, so Jane, definitely on the right track. This is a case where even though the pain got worse, pain doesn't shift from thinking unless it is a mind-body issue. So whenever you get a shift, up or down, you know that you're onto something. Now, the fact that the symptom then shifted elsewhere is another sign that you were on the right track. The distraction no longer worked. The function of that emotions column symptom didn't work. And it moved on. Now, if you hadn't been aware of this entirely and you were just starting to get a sense of it and the symptoms went up, it could have been that doubt would have come in and said, I don't think this is about thinking. It wouldn't have gotten worse. Maybe it's this. Then doubt may have taken over and cemented that symptom in place and not allowed you to move off from it. The fact that you were aware of this allowed you not only to have some emotional pairing with the symptom, but it also allowed you to move off of that symptom. Jane, please do let me know if that makes sense. Okay, Suraj Singh says, hi, Dan. It's good to see you on YouTube, Suraj. Please let us know if you have any questions. All right, looks like we have time for another preloaded question, but I need to check to make sure that this isn't a preloaded question that we've already answered, which could happen, but I always have more to say even about the same questions. Let's see. Claire says, I had 2 days being totally present and not even thinking of the pain and just a bit of chest soreness. Okay, this is a new one as far as I know. Then I got worried about the crackling at the fascia in the chest and got back into that fear spiral and had a really bad rib pain flare a few hours later. Managed to calm myself down and pain went somewhat. It never really goes full, and I just feel odd in my body. Okay, I'm really glad we're getting into this question, and it's definitely a new one because I have not encountered it yet. So, Claire, this is a great example of doubt column work. And it's a great example of why doubt column work is so important. Claire's been oriented to the system. She understands it, and it is allowing her to use the doubt column to break through these various levels of doubt. And what you need to know is that doubt is going to continue with a kind of onslaught. It's going to keep trying. It eventually starts to calm down, though, when it realizes it can't get you any way that it tries. And that it'll keep trying, but if you catch it in all its forms, it either tries something, a more subtle form, or it might settle for a lesser symptom, or it might give up for a certain time and then try to come back around something. Maybe there's some kind of triggering event in the environment, and then it tries to come back. Doubt is with us for life in a sense, in that it's always going to try to get back in. But if we're always aware that doubt is playing a role, it can only get so far. And its hold over the land becomes smaller and smaller and smaller. We gain more and more territory. Could it win some battles and gain back some territory temporarily? Yes. But overall, we're shrinking it. Now, if we look at what Claire just said here, these are good examples of it. She had 2 days of being totally present and not even thinking of the pain, and just a bit of chest soreness. Well, ultimately, this is essentially where everybody's going to get to if they get rid of the doubt enough, they process their emotions column enough that they can address the acute symptoms, and they're not stuck on some kind of plateau that requires a power column solution. If you've worked enough at the columns, you do have days like this. In fact, the way I experienced it, especially when I was getting better from the back pain initially, it was almost like, oh, I forgot to hurt. And in a way, that is what happened. I forgot to think about it that way. I forgot to think about myself as a pain sufferer even, which I don't anymore. I think of myself as a human being with a mind-body process like anybody else. And as a result, I don't tend to think a lot about pain and symptoms unless they happen to come up, which that's emotions column because it just comes up then. Sometimes I have a power column thing when I'm processing a trauma, but mostly my experience is nothing chronic, and acute symptoms can get addressed in the emotions column. So, I guess I would also say there are moments where I feel out of power and I need to address it. But other than that, that's where I live. What Claire is describing is that she got there for a couple of days. Then doubt came in. And doubt always wants to come in when we start to become powerful or when we seem to have mastered it. It wants to get us at those points because it doesn't want to lose its function. It wants to remind you, oh, this could be confusing, because it has to establish itself even for later. That's why it's always working. So then she says, I got worried about the crackling of the fascia in my chest, and I got back into that fear spiral. Doubt is always going to attack you where it works. So whatever you might be afraid of, that's where it tends to attack. It's helpful to know that, though, because then we can see it coming or see it arriving, and we can call it into question and take it apart. And by the way, that's what Claire did. She did get into a fear spiral. Then she got a really bad rib pain flare a few hours later, but she managed to calm herself down. And the pain went somewhat, and it never really got full. Now, this is another key point for you guys out there. The worst of the pain is going to come with fear. There are 4 types of doubt. There's fear, there's confusion, there is a lack of certainty, and there are questions. And, in the process of writing my book, I've come around to a certain idea that can be very helpful, and I call it the fear-confidence spectrum. And that is that ultimately you want to move from fear to confidence. And as you do that, you're going to move through different types of doubt, fear being the worst. If you can bring down fear, you might still be confused, but that's not as bad as fear. If you've brought down confusion enough, you might not be certain, but that's better than confusion. If you've gotten to a lot of certainty, but you still have questions, that's better. So we're moving through different types of doubt, moving towards less and less doubt. If you don't have fear, you will not have certain symptoms. Certain symptoms only operate on fear. Spasms is one of them. Really, really bad doubt column pain and other symptoms tends to be from fear. If we get past that, at least we've entered confusion. Believe it or not, that's an upgrade. It's no fun, but it puts a cap on just how far it can rise. And Claire, I think that's what you're seeing there. So, Claire, if you're watching this, I want you to weigh in and let me know how that all sits with you, because ultimately, and I say this all the time, it does not matter what I think. It matters what you think. What I think can be helpful in informing you, but then ultimately you've got to work with, what do I think about this and how do I feel about it? Okay, we've got a question coming in from Instagram from Catherine Toomer. There's a response, though, to Jane Smith. Give a response to Catherine. Hold on one second. Jane Smith said, thanks, Dr. Dan. Super helpful. Now I just have to figure out how to use the emotions column to shift things into better rather than worse. That's right. Glad to hear I am on the right track finally, though. So let me add one thing, Jane, to that. I think one of the reasons that the symptoms probably got worse in that moment, but you were still able to get past them, is that you still have some doubt. So when an emotions column event happens and the symptoms go up or down, we're getting a sign that our thinking does relate to what's going on. If we have doubt, though, especially if we have fear, the chance that the symptoms go up in those moments is higher. So if we work to bring doubt down, we're actually using the columns together. It's still an emotions column issue. Remember, I say, what's the primary column? Well, the emotions column is the primary column. In this case, doubt could have become the primary column if you got worried about that getting worse. Instead, you didn't. And because you didn't, the symptoms shifted off of it. But if we bring down fear even more and you're certain about it, and this is the way I am in my emotions column, when I go after an emotions column symptom, I think of myself as like a vampire hunter. I'm going to go after it and I'm going to kill it. And I don't have doubt about it. Very, very rarely. It does happen occasionally, but that allows us to make a change in how we're thinking about it and relating to the symptom, and that could help that emotions column shift to be better rather than worse. So just something to think about, but you are absolutely on the right track. This is a big breakthrough. Okay, Catherine Toomer says, hi, Dr. Dan. Since last week, things are gradually getting better. Glad to hear that. Still processing past trauma and trying to receive the fullness of the trauma. One lovely thing, the joint pain that started abruptly when I went off OCD medication has diminished greatly, even disappears some days. In trying to find the emotional source of this joint pain, which has come up as fear that I wouldn't be ready for my new job, nanny to my 6-month-old grandson. It's something I'm good at. So it was TMS making me fear and get pain. Great, great point. So Catherine, here's the way to think about that. A big part of what we've been dealing with lately is power column work. She adds, by the way, it's also anxiety about getting old and eventually dying, but it feels good to get that out in the open so it won't cause me psychic and physical pain. Okay. Thanks for that, Catherine, that addition. I want to actually address that afterwards because I read it and I was like, ooh, sometimes you guys give these very juicy nuggets that have a lot of information in them to talk about. So I'll get to that in a second, but let's jump back. to what's happening here. Catherine and I had really been doing power column work. If you've been watching the Q&A recently and the questions she's been asking, it's been heading more and more towards power column work, which is, it tends to be what happens as people get further along in the system. But what you're describing here, Catherine, is that you're making these huge gains because there really isn't a lot of doubt left. So it's not clouding the picture. And even seemingly chronic issues, or as I call them, consistently acute, are getting better. The joint pain with the OCD medication, it couldn't get better because you were on the OCD medication. So you never got the direct contradiction that you don't need that for this. You bravely tried that, weaned yourself off of it, had the chance to do battle with that doubt, and you're winning. And it went away. Now, what's coming up now is fear that you wouldn't be ready for the new job. The way I think about that is this is doubt fighting back against power, which is something that I describe a lot. When you get to the power column and you're doing more of that work, you need to know that doubt is especially going to want to come in then because it wants to prevent you from becoming powerful. So, Catherine, thank you for these observations. It's super, super exciting. You're making breakthroughs. And every breakthrough you make makes you stronger the next time you're dealing with a symptom or the next time you're dealing with a doubt that you can get better. You can look back and say, well, wait a minute. Remember how much doubt I had about the joint pain or about getting off the OCD medication or the combination. Catherine, we have just struck a major blow against doubt. And every time that you do that, you get stronger. But doubt will then always try to dance to another thing. This is why I say when you're dealing with doubt, isolate one doubt at a time and kill that doubt. Catherine, I'm going to get back to you because the aging question actually is a form of doubt, even though it's totally understandable. Doubt is always looking for a plausible way in. So it found one. And we'll get to that in a second. I want to get some questions from YouTube before I do that. Roebuck Studio has joined us, though, and I wanted to say hi. Good to see you. And Maureen is here as well. Thank you for joining us on Instagram, Maureen. Okay, we've got a question coming in from Jamie Woolner. Jamie says, hey, Dr. Dan, can you talk about the role of breathing modalities in bringing one out of a stress state? Okay, one of the reasons I love these Q&As is the variability of the questions. It's very helpful for us all. It's helpful for me to review these things and answer them in new ways, but it's helpful for the viewers because they get a very wide range of ideas and understandings about these things. So here's what I'll say. In terms of breathing modalities, I have seen amazing things with meditation. I've seen amazing things with breath work, and I don't know a ton about either, honestly, but I have direct experience. I mean, I've actually seen people with breath work, so I've seen it directly and heard from them what it's like. So I completely believe in it. Meditation, I've done myself. I have a certain meditation that I do, which I'm happy to talk about here and tell people how I do it and why I've chosen to do it that way. But here's what I'll say. Breath work and breathing is very, very effective at reducing stress states. If you think about it, hyperventilation is the opposite of this. It makes everything worse. It happens because you're in a stress state. So there's a direct correlation between your breathing and stress. Usually that comes from a very natural response of when I'm stressed, my breathing gets more shallow. But breathing modalities allow us to basically get in there and directly make the choice to alter it and kind of reverse engineer it. And that's essentially what is happening. Now, I think the columns work is can be particularly important because it can help us not be in a stress state as often. But once I'm in it, going with meditation is fantastic. It works very, very well if it's done well. And each person has to get to the place where they can do that. But, you know, in terms of the role of breathing modalities and bringing one out of a stress state, I think it can be a very, very helpful tool. What I would say, though, is that there's various forms of meditation. And if one isn't working for you, I want you to find one that does. You know, don't stop asking questions about what works for me and what doesn't. There are many ways out of stress states. The columns themselves are a way out of a stress state because understanding things brings stress down. Knowing what to do about things brings stress down. And there's a lot of how-to in my system as well, action steps of things to do. Meditation actually is one of the action steps, though. Especially if you're in a trauma state. Bring the breathing down. You can even do it while you're sitting right here. Not even a meditation. You can just notice your breath and say, wait a minute. Let me give myself space to breathe. And suddenly, things are calming down. And it's almost like giving ourselves permission. I'd say this is kind of a power column move. It's saying you have permission to calm down and take your time. And so that's another reason that I think breathing modalities can really help. Jamie, let me know if I answered your question to your satisfaction. If not, happy to say more. Okay, Karen Isaac says, I love the notion of being a human being in a mind-body system. There's not a day that goes by where this topic isn't on my radar. Lately, I have old symptoms that manifest with cough when talking. I have huge issues around people interrupting. I think that's not uncommon, Karen. A lot of people feel that way. I do too. I experience it in this way. This is like a power column interpretation of that. I experience it for better or worse. I'm not saying this is the right way to, it's not even the way that I would want to process it, but it's just the way that I do initially. I process it as, you think I'm not valuable enough to listen to what I'm saying. That's the initial response. And like almost no matter how many times I have that response, that is, or that experience, that is my initial response. But by recognizing that from a theme perspective and a power column perspective, I can think about it in the right way and be on my own journey to address that. One thing though that I think, Maureen says genius. Thank you for the compliment. It is a really helpful way to kind of be aware of the fact that these little things, supposedly, they're not little. That doesn't mean they have to be big in the outside world. It doesn't mean we have to call that person to task for interrupting us. But it does mean we have to honor just how important it is in our internal world. I mean, I was born into a world where my father died at 6 weeks old. I couldn't even speak yet. So my speech matters a lot. And if it gets interrupted, it has a very large significance. So Karen, what I want to encourage you is do not give yourself a hard time for however things manifest for you. If you have problems with people interrupting, you make sense and your symptoms make sense. So just think about why. And you may already know, I'm not saying you don't, but we could think that through. And it's really interesting that you're now having some old symptoms pop up. Sometimes old symptoms pop up when you're making progress because doubt is getting forced into an old corner. It can't go very far. So this is a good sign, I think, Karen, and I've heard you making progress in a number of ways. But one of the ways that you can make progress is what you said here. I love the notion of being a human being in a mind-body system. It's a very different way than thinking about, I'm the one with the problem, or other people are free of this. The reality is, everybody is a human being in a mind-body system. And those that don't experience it that much, they may have different psychological defenses that carry out a bit differently. It does not matter. Every single one of you, every single person that's ever been born is a mind-body human being. We all are. It just manifests in different ways. A lot of those people are like, oh yeah, I never have mind-body symptoms. I just have seasonal allergies. I'm like, there's ways in which it manifests and it can just be different. So Karen, I'm hearing lots of progress here, but I know you can be hard on yourself around certain things. And I want you to think about this. From a power column perspective, you can't be different than how you are. You came out the way that you were because of innate traits, because of your environment and the things you experienced, because of trauma. You can't be any different than you are, but you make sense. You make sense and your symptoms make sense. Pay attention to that and we can get a lot of lessons from that and get a lot out of it. And you can come to feel what I hope everybody comes to feel in the power column. It's part of the goal, is actual peace with yourself. And that could include the idea of people interrupting me is a big deal for a reason. And I know what it is. And that's being fiercely in your own corner. So Karen, we'll keep working at that, but let me know if that made sense. Dorisa says, highly recommend Qigong. It's breathing and slow movement. So Dorisa, certainly say more about it. I know that's been a big part of your getting better. It really is true though that breathing is one aspect that can help. And this gets back to Jamie's question. because he was talking about breathing. But I also think that slow movement is kind of another form that can kind of calm you down. I would say one of the things that we are often working on is let's slow things down. Trauma is when things are going too fast. They're happening too fast. We can't stop them, and we're stuck. It's like when you get hit by a tidal wave. You cannot control it. We have opportunities in life to slow things down. And when we slow things down, it's better. Even when I do public speaking, one of the things that I do is slow down. How do I do that? Here's one example. I remember to enjoy the moment. I get up there and I'll look out there and be like, mindfully, I'm standing up here. I gotta, and I don't mean that in a scary way, like, I'm standing up here. I mean it like I'm gonna enjoy this. So slowing things down can really help. And so, Dorisa, maybe that's part of why slow movement is another great addition. Okay, God Anticity is here, and Debbie Gladstone's here. Good to see you, Debbie. Good to see you both here. Okay, now, Karen has a follow-up. She says, I get mad when I hear people interrupting others. Just being witness to it irks me. So, Karen, there is a reason for this. And I think it's about disrespect, which you've actually said before. So, a lot of times when I'm making observations about you guys, it's because of what you said. It's not because I am somebody who can read your mind. I'm just somebody who really, really listens deeply to what you're saying. And the columns teach us to really take in what we are saying to ourselves. What are the symptoms actually saying? Well, think about this as a symptom. You get mad when people are interrupting. And Maureen observes from Instagram, so disrespectful. And it really is. It's basically, listen, we all interrupt some. It happens. We may not mean to at certain times. But I do find that at base, what it is what I have to say is more important than you right now. And so I'm going to go ahead and do it. Now, a lot of it's unconscious. Some of it can be accidental sometimes, but people who interrupt accidentally usually say, oh, okay, well, no, you go. That's different. That to me is not an interruption per se. I mean, people can feel that sometimes, but I don't think that's what Karen means. I don't think that's what any of us mean. I think that at base, we do have to think about what it is and let that in. I have an action step that is dipping into black and white thinking. This is an example of that. Black and white thinking about this is an interruption is saying what I have to say is not important. I don't want to listen to you. I want to talk. Now, are there times where the other person might have something really important to say? Yeah. But generally speaking, we should be able to manage that. We should be able to say, when you're done, I want to say something. It's a discussion. So I actually saw something this was a great meme that I saw, or at least a saying that I thought was important, which is it's better to have a discussion than an argument, because an argument is searching for who is right. A discussion is searching for what is right. And I find that interruptions don't happen in discussions. They happen in arguments. And that's not always, but much more in arguments. They happen when the other person isn't thinking about us, or maybe when we're not thinking about them so much. When we're really taking things in, that usually doesn't happen. Okay, I'm jumping back to you, Catherine. You had a comment that I thought was interesting and important. You said it's also anxiety about getting old and eventually dying, but it feels good to get that out in the open so it won't cause me psychic and physical pain. So there's a number of important things in what Catherine's saying here. One is, isn't it so great that we have the opportunity, no matter how upsetting a thought is, no matter how horrible it might be, that if we get it out in the open and we don't hide it from ourselves, we are doing preventative work from psychic and physical pain. That's huge. And the fact is, we are all very upset about certain things, and mortality is a massive part of that. I mean, there's nothing we're more upset about than mortality, for ourselves, for the people that we love. It's a really hard one to deal with. So the fact that you're talking about it, I'm glad it feels good. And I think that that's part of the power column, is to feel not afraid. Fear is a form of doubt. And by the way, I don't mean not afraid of dying. I mean not afraid of letting anything into our mental and emotional experience. It's okay to have these thoughts. We just then need to figure out what to do about it, and the columns help to organize that. So I totally get it. And I think it's a very hard thing, Catherine. What I want to encourage you about is I don't think you're doing this. I think this is more for everyone else who's thinking about this, who maybe hasn't done this. Try not, or really it's for anybody, try not to think about the fact that getting old and eventually dying is just generally upsetting, because of course it is. Get specific. It's like what I said to Jane earlier. Get specific about why. Is it, I'm going to die and nobody's going to remember me, or I wasn't even important? Is it that I don't like the separation from the people that I love? Try to get specific, because there's something in there. It's so interesting how these symptoms hide in the corners when we haven't ironed out certain details. Okay, Karen Isaac says, old symptoms are okay with me. I know what it is. It's not scary. Good. Yes, I think that can often be the case. Sometimes it's a sign, though, that you've reduced doubt enough, and now your either emotions column or your power column are just working on, I would say mostly the power column in your case, Karen, getting you a sense of what's the communication. It's saying, okay, well, you know what this is, but have you received the communication fully? I think that's the next step for you. I shouldn't say next step like you're not doing it, because you are, but it's the step you're on, and I can continue to help with that. Karen did say also, a friend had kidney stones. A urologist asked her what was going on for her. I was shocked and happy. There are doctors out there locally near me. The message is starting to get there. You know, on my mind-body PDF, the TMS Basics, I note that the American College of Physicians in 2017 released a great statement about this. You know, people are coming around to this. I think this is going to it's going to be the case that it's going to start to get taught more in medical schools. This is their own science. It's their own journals. The New England Journal of Medicine, JAMA, the best journals in the land and in the world are showing the same things. And so this is good stuff. But really, the idea that a urologist asked what was going on for someone emotionally with kidney stones is music to my ears, and to you too, Karen, I know. Okay, Dorisa says, in addition to breathing and slow movement, this is about Qigong, you are taking time to be in the moment, and your body and mind can align. Mindfulness is another example of that, and I guess that's in line with what you're saying, Dorisa. Mindfulness is another way that we slow things down. I once taught a mindfulness training during my years when I was a staff psychologist at Fordham, and I had them eat a Hershey's Kiss mindfully. It's a totally different experience. When you eat it non-mindfully, you're like, oh, it tastes good. But you're like, what happened to my Hershey's Kiss? When you do it mindfully, you take it in. You're really slowing it down. I love the point, Dorisa, that you're making, though, that you're giving yourself a chance in that moment for your body and mind to align. And I think the column system provides information that makes that alignment make even more sense. So then it's not just you're aligning, but you're also seeing how and why. So very good combinations, and shows how all of these things fit together. Okay, Maureen says, and I love that the other person, I think this is about interrupting, and I love that the other person will keep swearing it's a discussion when it's clearly only your discussion with yourself. Yeah, listen, guys, you all have been in these discussions before. I know I have. It's like you're having two parallel discussions, and you're like, do I even need to be here? And sometimes I can take it as kind of an annoying thing, or maybe a personal insult. There are other times, though, where I just take it as, do I want to waste my time with these things? It's, you know, I'd rather kind of move away from somebody who's not going to have a true give and take. It's happened to me frequently. It happened to me yesterday. It happens all the time. And we get to decide, it's kind of a power column move. Do I deserve to be in a better discussion than this? Or I guess better said in the way that Maureen said it, do I deserve to be in a discussion as opposed to a situation where somebody's just talking at me to hear themselves talk? I have lots to say. I like what I say, but I would much rather be in a discussion with people. And I think pretty much everybody in this audience feels pretty similarly to that. Okay, Sylvia says, Tastes good. Where's my Hershey's Kiss? Oh, I see. You were quoting what I was saying. Yeah. I told them, I was like, look, how often do you eat lunch and think, where did it go? You weren't even there to enjoy it. It happens all the time. So being mindful is another big part of things. And I think that fits with Jamie's question about breathing again, and Teresa's comments about Qigong. Being where we are makes a huge, huge difference. It's even true here, like in the Q&A. I don't want to be anywhere else but here right now. It's part of what I love about it. And we get to have a much richer discussion, not only because I'm here that way, but because that gives some space for the audience to be here in that way. And then you guys bring that on your own as well. So we got a lot of good stuff going on here. Okay, Teresa says, love mindful stuff. I do mind-body yoga routines sometimes. Yeah, these are all very helpful ways to align with ourselves. The columns gives us another way to be overall aligned with ourselves, especially in that power column. And then it makes breathing and mindfulness and, kind of slower movements and all that stuff all the better. So we'll keep at that. Bart F has a question. What do you think about ayahuasca? I've never tried it myself. I've heard great things about it. To me, it just kind of makes sense that some of these very powerful, I wouldn't call ayahuasca medication exactly, but kind of mind-altering substances really change the picture of what people are seeing. Anything that opens the mind in a deep way can be very helpful. So, Bart, I think with ayahuasca, I guess I would say this. Make sure that it's something that can be helpful to you. So if it feels like it's going to be scary, maybe you wait on it. Maybe you talk to people about it. But if you're excited to try it and you've heard good things about it, I've heard good things about it too. Anything that creates movement is that way. Brain spotting is this treatment that I mentioned. I think I actually mentioned it in group today. I don't think I mentioned it here. But brain spotting is a trauma treatment that really gets at the cortical brain. Well, ayahuasca basically does the same thing, from what I know. And there's lots of things that allow us for deep, deep processing. When you're open to it, I think it's a potentially great thing. Bart, weigh in, please, though. Let me know what you think about it. I want to hear from you. Okay, Sylvia Sierra says, as a linguist, I'm struggling with this conversation around interruptions, Dan. They are so subjective. But I agree people need to honor how they feel in the moment. So, Sylvia, I understand what you mean, and I think that, to me, it's about, like you said, it's what it feels like to you. I don't think it's necessarily, it is true. They can be very subjective. I will say this, though. Sometimes they're not subjective. And I'm curious what you think, Sylvia. But I think that an interruption that, if you actually looked at the motivation behind it, was designed to interrupt is a true interruption. To me, it depends about the motivation. Now, is that hard to figure out? Yes. So with subjectivity, yes, that could be hard to figure out. But I think that's a way of thinking about it is, if there's an intention to interrupt and to shut down your conversation, that's a different thing. That's an act of aggression. There are many times where it's not meant that way. It could be, I'm so excited to share this with you. It could even be going towards somebody. So I think that's part of what you mean, Sylvia, but do let me know. Okay. Maureen says, with mutual respect and appreciation of others' opinions. Yeah, that's the kind of discussion we're looking for. Scotty Styles, good to see you here. We're going to finish on this. But Sylvia, I want to have more discussion about that linguistic idea. I think that's really important. Maureen says, a conversation is in essence a ping pong back and forth. So true. The interruptions are to shut you up. It's an act of true aggression. I think we just need to think about what's the motivation. And I do want to encourage you. There's a lot more aggression in there than some people tend to think. There are other times where we can interrupt each other all the time, but just be totally excited about it and feel good about it. So really interesting. Okay, one last thing. We're going to get to Catherine Tuma here. This slowing down, in quotes, idea sounds good for helping in the middle of my knee-jerk reactions and then lashing out at my husband. He's not in town with me right now, but I think things were improving by the time he left. I'm sure it's not over. I will welcome the challenge when he returns, as well as when the knee-jerk reaction happens elsewhere. So, Catherine, I love that we took the judgment out of that from last time. We helped you find a way in your power column to give yourself permission to work this through, and you're doing that. Now we're maybe building in another action step. Slow down here, and it can help. Scotty Styles, I see you saying hello. Good to see you. All right. Sylvia, one last comment, and then we'll wrap up here. Sylvia says, yes, I would say like during political debates, especially Clinton versus Trump debates, it's pretty clear cut. But many, if not most times, people can just have, hold on, that scrolled up, different norms for when it is appropriate to speak. That's true. And also cultures. I was just about to bring that up. Different cultures are different. So Sylvia says some cultures, even within the U.S., actually enjoy overlap interruption. It's a way to show excitement and engagement. But if someone doesn't share that norm, it can go poorly. Very useful and important observations, Sylvia, and I don't disagree at all. I think it's about intentionality, though, because what you're saying is, well, in those cultures, the intentionality is to connect. And sometimes intentionality doesn't line up, and then we do run into an issue. But that at least can, if there's a discussion, because the intention was good, we can reconnect and have it be a good thing. Whereas if the intention is aggressive, we're going to be in trouble. All right, I'm looking forward to talking more about that. Jane Smith adds, this was so great, Dr. Dan. Thanks again. Rather exciting to hear that you confirmed I seem to have had a breakthrough on the emotions column. You absolutely have, and it's exciting. Every breakthrough is exciting because it means it's starting to make sense. The column system is designed to give you a framework that can make sense, but sometimes it takes time and working it out. So we will keep it up. Guys, it has been a pleasure as always. I will see you the same time next week. That's Mondays, 6 p.m. Eastern, 3 p.m. Pacific. And I look forward to talking with you more. Lisange, you just joined us, and I'm sorry you're joining right at the end, but please do come back next week. We're here Mondays, 6 p.m. Eastern and 3 p.m. Pacific. And you guys ask such great questions. And these questions you ask, they hopefully can help you get answers. But by asking the question, you're helping other people too. Because they may have a question they hadn't thought of. Or maybe they had a question and they were afraid to ask it. You guys are doing a lot of good work for each other. So please do keep it up. And I will see you next week. Take care.